You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxie Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Lauren Grawert, who is the Chief Medical Officer at Aware Recovery Care. Welcome to the show, Lauren.
Thanks, Roxie. Thanks for having me.
It is good to have you here. So start off by telling our listeners a little bit about your background and what you've been innovating these days.
So I am a physician by training and background. I'm actually an addiction psychiatrist. So I did 4 years of medical school, followed by a psychiatry residency, and then followed by an addiction fellowship. After that, I served as the chief of psychiatry for Kaiser Permanente of the Mid-Atlantic for about 8 years or so. And then last year came to become the chief medical officer at Aware Recovery Care, which is an organization that does in-home addiction treatment.
So what does that look like? I don't think I've heard of that before.
Yeah, so if you imagine in healthcare, there are other fields where providers will go into the home to provide more individualized, comprehensive care. So we've kind of taken that idea and applied it to the addiction field, really to try to address addiction treatment from a whole person perspective, and also address family as well. So, we know that addiction is it's a brain disease with behavioral manifestations, but it also affects everybody around the person who is suffering from the disorder. So we send a multidisciplinary team into the home. And when I say home, sometimes folks will choose to meet us at a bowling alley, at a skating rink, at a Starbucks, wherever they want to meet, and work on relapse prevention skills, recurrence prevention skills. We give folks a case manager, a therapist, a family therapist. We have a medication component as well, and really just a holistic approach to addiction treatment.
So I'm just curious, is that help overcome, I don't know if I would say stigma, but I'm just going to say stigma around going to a treatment center and kind of being more inpatient? Is this to kind of like be able to capture some of that audience that might not go to an inpatient facility?
Yeah, I mean, that's one of many reasons. And I think the word stigma is the correct one to use here. Unfortunately, in our society, there's still so much stigma around addiction treatment, and honestly, a lot of misunderstanding. We know that only about 10% of folks who have a substance use disorder end up seeking treatment, and that's for a lot of reasons. But some of it is anonymity, wanting to have more anonymous treatment. Some of it's wanting more personalized, individualized treatment. Some of it's financial reasons. Inpatient facilities can be pretty costly and sometimes out of financial reach of most people. And I think I would say the other reason probably is that, lots of people cannot go inpatient for family reasons or employer reasons. And so this allows people to have treatment who might not otherwise be able to because of other life responsibilities.
Yeah. Okay. So one of the things that we do on this show is we talk about, not necessarily the sexy tech, although that's part of it that comes up sometimes, or, the tools and the solutions that are being innovated. But we really like to dig deep into that commercialization journey. So that way, from founder to founder, leader to leader, you're sharing, how do you build something out of nothing in today's market, especially going through the complexities of, the healthcare ecosystem. So let's just talk a little bit about the origin story and, where you are today.
Yeah, great question. So Aware was actually founded in 2012, and I can't take credit for it. Our founder was a really, really smart guy who had been working in the pharmaceutical industry, who was in recovery himself from alcohol, and had asked some painters to come over to his house to paint. And so the painters were there, and the painters, incidentally, were also in recovery as well. And so our founder, super nice, chatty guy, they started talking, and he started saying, in the painting industry, you guys come to me. Why can't that be the same in the addiction treatment industry? Why can't we have people come to the person? We always say in medicine, we meet people where they're at. but
Yeah.
we don't really physically meet them where they're at. And so
Uh-huh.
they got to talk, and they were like, yeah, why does that exist? Well, it should exist. Which
Yeah.
is where the idea was kind of born, with these painters and this really smart, funny guy in recovery himself. So he started talking to others, got the idea off the ground. We have a value-based care arrangement with payers, which is
Mhm.
really nice because it's not chopped up with a fee-for-service type schedule. But that was
Yep.
the genesis of it, was, hey, why doesn't the addiction industry have something that every other sector really has, where people come to you? It kind
Yeah.
of took off from there.
Wow, 2012. It's kind of before the home health movement, really, in a lot of
Yeah,
ways.
yeah, it really, I mean,
Mhm.
yes, it really kind of predated that. I would say the infancy. We really saw a huge growth during COVID. I think that
Yeah.
was a great time to be an in-home organization, because it
Yeah.
was, the first time in medical history where there were real, legitimate reasons that most people could not do in
Yeah.
person or in inpatient treatment. And so we were really able to reach a lot of folks during that time. And we're still able to reach folks who are looking for a personalized, comprehensive addiction treatment journey that is chronic. That's the other thing. We know that addiction, it's a chronic disease. It's different from getting pneumonia, where you get pneumonia, you go in, you get a medicine, you're better, you leave. It really does
Yep.
require lifelong care. And so we really embrace that model and help folks along the way for a journey. And as they finish our program, we also get them ready to be connected to community resources, so that they have that support when they leave our program as well.
Mhm. Yeah, there's a lot of innovation happening in this space. So, what are some of those commercialization milestones that you can think of that the company's achieved over the last, 12, 14 years?
Yeah, I would say probably getting our first major payer contract was a huge milestone.
How long
We
did
worked very closely with Anthem, also known as
Mhm.
Carelon.
Yep, yep.
um,
Mhm.
they've been a great supporter, so that was huge. That really helped to take us to the next level. Um, and so that was probably the first major one. I would say um, expanding to other states was really big for us as well. The founder is from Connecticut, Wallingford, Connecticut, and so as we got this large national payer contract, we were able to strategically reach out to states that have large Anthem members,
Mhm.
and had
Mhm.
a partner among others to kind of help us guide us to where kind of those folks were. So yeah, I'd say the payer contract was big. The expansion into other states. We went from 4 states to 12 states in about
Mhm.
2 years' time. So those were some of the, I would say, the big
Yeah.
things
How long did
as
it
well.
take you to get your first payer contract?
Oh gosh, that's a great question that predates
Yeah,
me.
those
If
long
I was gonna,
sales cycles in healthcare, right?
yes, yes, I would say if I'm guesstimating, probably 2 years or so. Um,
Mhm.
so the challenge, I think, is um, as you said, there's a lot of choices in the addiction treatment industry. So there's a lot of I guess vendors, for more or less, that payers can choose from.
Mhm.
But the other thing is, I would say, to healthcare innovators, probably well know that negotiating a value-based care contract is very challenging. It's
Yeah.
like the unicorn of healthcare. We all talk about how it's the way healthcare should go and it's the right thing for the
Yeah.
patient, and all that's true. But it is so
Mhm.
much more challenging to negotiate that, rather than a standard fee for service where there's CPT codes that are already there. But I think it really shows our commitment to um, approaching addiction treatment in a way that truly is best for the patient. It's way more work on the front end, but it really is the best kind of treatment for the patient. So
Yeah.
that's, I would say, one of the coming into the role, one of the most challenging things that I underestimated was just the complexity of a value-based care agreement, and the time it takes, and the individualization. Again, like, there's no CPT codes for that, so you have to kind of come up
Right.
with that, and work with large payers, kind of in a way that's going to be synchronous.
And would you say that, in my experience, developing that contract is there's a huge finish line when you finish that, right? When you get everything signed and ready to go. But in many ways, it's also the start line. And there's a lot of management, right, to make sure that everybody's getting the value and the ROI out of the program as well.
100%. Yes. I think you phrased it perfectly. It is the finish line and the starting line. Particularly in healthcare, as we move more towards measurement based outcomes and measurement based
Mhm.
care, which I also am really excited about. I think it's high time we
Yeah.
move that way. It helps keeps treatment providers accountable, but it also involves another lift in terms of the technology and the departments for an organization to have to be able to produce that kind of data on a mass scale.
Mhm.
So
Yeah.
that I think is a good way healthcare is going, measurement based outcomes. Um, and at the same time, also is something that takes more time, internally to develop.
You touched on something that I think is really interesting is just the power of networking. I think often that is something that's overlooked, maybe perceived as kind of a nice to have in the commercialization journey and not necessarily a must have, especially when I'm working with technologists who are very much product focused, who maybe aren't active on social media at all. Like that blows my mind, right? Like I don't even have an account, or I have an account, but I haven't touched it in 10 years, and aren't thinking about how they need to be building that community and that network just as much as they're building in new features and functionality to the product. Because it's a lot harder. I mean, if you are trying to do that only when you need something desperately.
100%, 100%. I mean, I look at every as a physician and a business person at the same time, every opportunity as an opportunity to talk about aware. I think a great
Yeah.
example. I do a lot of medical writing, medical advocacy, addiction literacy, and I always think of that through the lens of helping with addiction literacy, but also increasing brand awareness. And
Sure.
so I think there's
Yeah.
so many
Mhm.
ways that you can do that. And the more creative and non traditional you are, the better, for
Sure.
sure.
Yeah, absolutely. Trying to break through the noise, right?
Yes.
uh, so what would you say is the number one commercialization strategy that's led to the success of the company?
That's a great question. And I was thinking about this, this idea before we started talking. Um, I would say this is going to sound, at the risk of sounding inauthentic, authenticity. Um,
Yeah.
Meaning that we really, I mean, every single interaction that we have as an organization is really genuine and really, really, really patient focused to a degree that I don't think you see quite so much in traditional addiction treatment. Um,
Hmm. Hmm.
Particularly, I mean, I'll give you a good example. This past 2 years, we've really put a focus on harm reduction approaches and moderation management. And so that means people whose goal is not necessarily to be sober, but they want to cut down their drinking, let's say. And so we really try for our message to be authentic, to be what is best for the patient and from the patient's perspective. So it's not like
Hmm.
saying, Dr. Lauren says this is best. We go out and talk to patients. We talk to our patients. We do surveys. We say, what would
Yeah.
be better? What should be different? What should addiction treatment look like? And then we try to be some of the first people to really start talking about that, which I think
Yeah.
has resonated with a lot of patients in a way that other traditional addiction treatment, doesn't necessarily talk about.
Yeah. That touches on something that we do talk about a lot on the show, is this idea of kind of co-creating the company and the solution, the experience with the customer, and not doing that, for a project. Like we're going to do that for the next 12 weeks and survey them and ask them what they want. But it's something that feedback loop kind of becomes part of the DNA of the company, and we woven into the fabric of the company, and it's just what you do, where you're always staying in connection with the customer, so that way you're able to anticipate and witness those shift in needs and desires way before the competition.
Yes, yes. And I always tell folks, like, assume you never know enough about your customer or patient. You know, it's impossible to know too much. Like, I'm always searching for what are things that people are looking for in addiction treatment that we're not talking about yet, maybe that are taboo to talk about. And so,
Yeah,
yes, I think going into your organization or your business with that perspective of to be hungry to know more about the customer or patient experience is so
yeah,
important. And also where I see people struggle,
yeah.
organizations struggle who are not listening to the patient perspective, or who say they are, but maybe the words aren't matching the action.
Yeah, yeah. Those patient-centric organizations that have never had one real conversation with their customer except for the business that's being done. Right?
100%. Yes, yes.
Yeah, yeah. Or when they are, all they're looking to do is just validate their assumptions and biases. They're really not on that fact-finding mission that you just described, where you're truly seeking out of like, what can I learn new that I don't already know?
Right. Yes, yes. That's super important as well. Like going into it being humble enough to say, if I find out some stuff that's helpful that necessitates change, I'm willing to make that change versus continuing to search for the answer that I already believe and endorse. Yes, very
Sure.
different.
Yeah. Yep. Yeah, exactly. So what's next for Aware? Where are you guys going from here in 2024 and beyond?
Yeah, well, we've recently added virtual products, virtual medication assisted treatment, virtual psychiatric med management, and what I'm most excited about, because nobody else in addiction is doing this, virtual detox. So we do
Oh,
completely virtual detoxes for mild to moderate alcohol use disorder, mild to moderate opioid use disorder. There are lots of folks in the this ecosystem that are doing opioid treatment. But I don't know of a single organization that's doing alcohol detox virtual. And so I'm really excited about that. It opens
what
up
does that
care
look
to so
like?
many people. And what's that like? Yeah.
Yeah, what
So,
does
and,
that look
and
like? Yeah.
somebody asked me not too long ago, they said, Lauren, there must be a reason nobody else is doing it. Why is that? And I said, yeah, well, because in medicine is not risk free. I mean, alcohol withdrawal we know can be life threatening.
Yeah.
It can cause seizures. It can cause delirium tremens. So most healthcare providers, if you're not really highly trained in addiction treatment, they're going to err towards just admitting every single person. But the
Yeah.
reality is that about 88% of patients who have physical withdrawal symptoms from alcohol can safely do an outpatient detox. We ask that patients have a blood pressure cuff, the kind you just like literally press the button. So we're able to get vital signs. There are standardized criteria that we use. One's called a CEWA scale that measures the intensity of their withdrawal. And we do have a
Mm,
pretty comprehensive screening process. So we do a 90-minute screener up front to make sure that they don't have medical conditions that really exclude them from this level of care. But those are the basics. It's a 7-day program. You meet with a nurse practitioner who is specialized in psychiatry and addiction on day one. We come up with a medication plan. Then we have 6 more days in a row where we're meeting on camera with the person to see how their withdrawal is going. We can tweak the
mm,
medication journey if we need to. And then on day 7, they complete
mm.
that program. And some people will continue on to just do outpatient med management with us. And other folks say, you know what? I'm good. I'm feeling better. I'm jumping back into work. See you later. And we also say that's okay too, which I
Yeah.
think also makes
Yeah.
us different. A lot of people would
Sure.
say, no, you have to stay in treatment. We
Agreed.
really try to honor patient autonomy and agency in this whole process, and kind of let them lead the journey while we're holding their hand along the way.
Yeah, I can think of so many personal stories that come to mind. And I wonder if you hear that often, in the work that you do, whether you're at like a cocktail party or, a group dinner, when people are just having that casual conversation of, well, what do you do for a living? And you start to tell them about Aware and the work that you're doing. And, I wonder if everybody has a story of, oh, I wish so and so would have had access to this, or I know someone or someone's that need access to this. Mm.
Yes, 100%. It comes up all the time. People saying, "Oh, my sister would benefit from that. She doesn't have the money to go inpatient." Or,
Yeah.
"Gosh, my brother's been struggling with work because he's oversleeping and struggling with alcohol, but he can't miss work." We had a great example, really lovely patient who went inpatient for alcohol withdrawal, got
Mm.
treated inpatient, but found out while she was there that she was pregnant. And so when she was discharged, she was really
Whoa.
struggling to find an outpatient provider who was going to assess her and be comfortable continuing medications for alcohol and pregnancy, continue mood medications during pregnancy. But she absolutely had to have an outpatient provider because she needed to continue work to have healthcare benefits.
Mm-hmm.
So, I mean, that's just one example. She was a perfect fit for our program and has been able to maintain sobriety during her pregnancy. She's on medications now for depression, which has also improved her stability with sobriety. And because we
Yeah.
have family therapists, she has a much better relationship with her mother. So we've had lots of
Mm.
sessions with the mother and the grown daughter, and trying to strengthen that relationship before this child comes into the picture. So just like you said, there's so many examples of folks who need addiction treatment and often really want it, but can't for a variety of reasons. And we're just trying to break down as many of those barriers as possible.
What's interesting is I don't know if you'll agree or disagree with this statement, but it almost seems like it's more cool than ever to be sober. You have Drew Barrymore, you have Katy Perry, you have all of these different celebrities that are coming out and speaking about their struggle and their position on sobriety. I scroll on TikTok and there's people that are doing like, I don't even know what they call it, but like alcohol coaching, like coaching people into not drinking. I mean, just alcohol buddies. Again, you're not somebody that you go drink with, but there's a better phrase for it. But, like this organic kind of partnering of people to try to, have a partner that's helping you in that. It just seems like it's a lot mocktails that just seems like there's a lot of trends that make it not easy but easier, more cool or accepted to kind of move into this direction.
Yes, and that's how I would summarize it. Not easy, but way easier. The sober curious movement, I think,
Yeah,
is
that's
one of the
yep.
greatest things to come to addiction treatment.
Mm.
We know that almost any level of alcohol, even if it's in what's considered safe, which is
Yeah. Mm.
less than 3 drinks a day for women, less than 4 drinks a day for men, even if you're in that category, it still has elevated risks of cancer. It still has elevated risks of dementia. It
Yep.
still has
Yep.
elevated risks of all kinds of things. And so um, the sober curious movement, I think, has been great because it
Yeah.
offers folks an avenue to have their journey be whatever they want it to look like.
Mm.
The
Sure.
mocktails are great too. I will say like fair disclosure, I don't have a substance use disorder, but all of this information that has come out about alcohol over just the past couple of years has really like made me rethink how much do I want to drink.
Right.
Particularly it
Agreed.
increases, right? I mean, it increases
Yeah.
the risk of
Yeah.
breast cancer by 15%.
Yep.
I'm sorry,
Yep.
15 times. And so
Yeah.
being somebody who has like a mother and an aunt who's had breast cancer, I have been searching for mocktails, and there's all kinds of great ones out there.
Hmm.
My favorite
Hmm.
one, Free AF. Free AF.
Okay.
You can
Oh.
guess what the AF stands for.
Yeah.
It's a woman-owned company. They've got
Uh-huh.
really cute bottling. They've got every
Yep.
flavor you could think of, and
Uh-huh.
That's my current favorite one. But there, as you
Yeah.
said, there are so many out there. And I think
Yeah.
that is one of the exciting things about addiction treatment now is there
I'm
are
I'm with
certainly,
you. As I read and study a lot about brain health, just personally, as well as longevity, like there's always this heightened awareness and insight into, like you said, it might be normal, it might be very little, but I'm also reading and understanding how it affects my brain and my health span. And I'm like, maybe I don't want to have that glass of wine with dinner. Maybe I do. Maybe I
yes,
don't. Right? So
yes.
just yeah, exactly.
I will say
uh,
too, like, so I just got back from the American Society of Addiction Medicine. They had their national
mhm.
conference about 2 months ago, and there's a section where we go over all of the most Googled or the most read addiction research studies of the year. And so in
Mhm.
2023, the most Googled and most read addiction study was one that was done in Europe, showing that with some pretty compelling evidence that whole notion that like one red wine a day is healthy
Yeah.
actually is really a fallacy. And the longer living that was in those original studies was more so associated with socioeconomic class. So
Mm,
people, if you think about it, let's just say like women drinking one glass of red wine a day tend to be in higher socioeconomic classes, and that correlates with better health outcomes, not
that makes
necessarily
sense.
the one glass of wine a day. And it was a huge news. Like none of us, including me, knew that or realized it, but it makes a lot of sense when you think about it now.
Yeah.
Um,
Yeah.
so yeah,
Well, menopause also has me rethinking it because it doesn't blend well with menopause.
sure,
Right?
yeah.
It's like, you don't want to necessarily have that glass of wine again because you're going to have hot flashes tonight and it's just going to make it worse.
Totally get it. Yes,
Oh
yes.
my goodness. So, Lauren, thank you so much for joining me. As we wrap up, is there anything else that you would want to share with fellow innovators out there that might be listening to this episode?
I would just say, like, as an innovator, if you're a specialty in a subject matter and you're looking to develop or take your organization to the next level, trust your gut. Trust your gut. That's my main advice.
Mm,
Because oftentimes, you're going to get noise from every single direction, and every person has an opinion. It's just like a
yeah,
nose. Everybody has one. But if you are in a field where you're a specialist and you've had a lot of experience in this field, and you're truly listening to all of the patients and consumers around you, trust your gut, because you can't go wrong going into a healthcare field with that perspective.
yeah, awesome. Thank you again. How do folks get a hold of you if they want to reach out to you after the show and learn more about Aware?
Yeah, so I'm on LinkedIn, Lauren Grawert. You can find me there. I have a weekly newsletter I put out that's just on general addiction topics. So
Yeah.
LinkedIn, our website, awarerecoverycare.com, has more information about our organization and the addiction treatment services. Either one of those are the fastest way. And if you Google me, there's lots of YouTube videos of me talking about addiction treatment, Suboxone, alcohol. So yeah, we're out there.
Not difficult to find you, right?
That's right.
All right. Well, thanks for joining me on the show today.
Thank you so much, Roxie. Have a great day.
Thank you so much for listening. See you on the next episode of Health Innovators.